name is Rita Weeb, and thanks for joining us for this next in the episode of Simple Synergy. Last episode, we did a little bit of work with the Men's Shed and their place in the community, and this session, we're going to be talking with the Kamloops Hospital Foundation and specifically the Occupational Therapy Department. We've got a few words from the Kamloops Hospital Foundation. Marissa Bertoli is her name, and she's got a little piece here. She'd just like to tell us about what's going on with the Hospital Foundation and the kind of things we do. And so, and then we'll be talking with some actual therapists. And with us today here, we have Allison Hallam and Jonathan Leung. And so, some of those things that we're going to be talking about are what and why people would go to occupational therapy, how they would get there, and how patients benefit. So with either or of you, would you like to start by telling us just what or why people would want to go to occupational therapy? Is it something for strokes or accident victims, or what would it be?
Well, we meet with clients with all kinds of different diagnoses. It could be injuries from a car accident, it could be a stroke, it could be mental health illness, it could be any number of things, and it runs the gamut between mental health, physical health, providing equipment for individuals who may not be able to do their everyday occupations. We assess safety. We assist people in going home from hospital. We also work in the community, schools, long-term care centers, industry. So really, we're all over the place.
Mm-hmm. That's pretty cool. And I've back to you, Jonathan, that same question to you. And also, is there anything from the mental part of things, like reteaching people after they've lost their skills for dementia, or any of those other things that Allison talked about?
Well, I might be a little bit biased, but I think everyone can benefit from some occupational therapy. So you did a great job covering there. But to add on to that, I think there's a lot that can be done with cognitive, with kind of planning, decision-making, problem-solving, and kind of helping people to age in place and just do the things that they want to do safely and healthily.
That sounds really exciting. So how do patients actually benefit? Like, maybe just talk to the patients out there in their living rooms and, just how can they benefit from, like, one example that I know of is somebody was getting on in years and could no longer find their way around a living room, and an occupational therapist came into the home and helped to reassemble the furnishings so that they could get their wheelchair around. Is that something you do, or is it like just helping people move or anything?
Absolutely. I think what you're touching on there is definitely a very important part of occupational therapy. A similar example would be we can often do home visits to look at the home and see if there's any kind of equipment that we can add, modifications that can be made to make it a bit safer and a bit easier to kind of do those daily tasks. So a specific example could be with bathing. We could take a look at perhaps the tub shower or the walk-in shower and see if there's any equipment, tips and tricks that would make that activity a bit safer and just a bit more comfortable to do day to day.
Wonderful thoughts. And just that whole idea of say bathing, like what about putting shoes and socks on and that sort of thing? Like, do you teach people to do that or give them ideas on the equipment to use? Or?
Absolutely. So as OTs, we help our clients do their everyday activities. We often call them ADLs, or activities of daily living, and that includes dressing and grooming, getting out of bed. So for something like dressing, we could prescribe not only some tools to help with that if you have weakness or have difficulty bending forward, but we can also look at the environment and how we can also look at the client's strengths so that they can do the activity to the best of their abilities.
Right. Excellent point. And what about people that need some help, whether they be family members or maybe care professionals that come into the home? Like, is that possible?
And so that's one of the things that we often do here at this hospital is we'll look at someone and we'll kind of assess their daily needs, see how they can manage those tasks, and see if perhaps home health nursing or something along those lines could be beneficial. And then we'll talk with the rest of the care team and determine what supports are best going to meet our clients' needs.
Perfect. And I have heard that it's kind of hard to get medical professions to come in and to hook up with doctors and that sort of thing and get referrals. Do either of you know anything about that, how a person would actually get into the system? Or is there private resources out there that people can tap into if they've got some extra cash?
Well, the nice thing about occupational therapy is that we work both in the private sector as well as the public sector. So there are several options for individuals. Many insurance plans cover occupational therapy, and OT is one of the services that can be directly accessed even without a doctor's referral.
Okay. Okay, well, that's a wonderful thing to know. So we've got a little bit of a treat here where we're going to actually look at some of the patient perspectives and just maybe put a little bit of a lens on how the patients feel about this sort of thing and working with the OT department. Take a moment and show you that clip.
Good day, I'm Todd Within. I had 3 strokes actually. My last one was in October, about 3-4 months ago. I've been working in this group with and a few other people, and they are all so nice. It's incredible. My movement had gotten a lot better. My balance is pretty good, and I'm looking forward to my future.
Okay, so what we're doing actually in this group currently, it's an upper extremity group. So we're working with several clients to help improve upper extremity function. We do a whole body workout, but we try to focus on someone's arm who's been affected by a stroke or other conditions. And what we do, we take measurements at the beginning of the session and then again at the end of the session, and it's about an 8-week group. And then we can compare how things improve over time.
Hi, my name is Jeff, and I'm a left side hemiplegic. In July of 2023, I had a heart attack, and after that I had a brain bleed, and also another stroke after that. I had a craniotomy that saved my life, and I spent a month in a coma, and several more months in the hospital, regaining my strength through physio and my skills through occupational therapy. What I learned about occupational therapy is it's mainly about the waist. It's relearning the skills that I had before my stroke, everyday things that I had done, such as getting dressed, a simple thing as getting a shirt on, brushing my teeth, combing my hair. I had to relearn how to do those with an affected left side and weakness. And OT helped me do that. I was able to use a lot of equipment, and I got such as a spin for my wrist, also with the wheelchair, basically so I could perform normal functions post-stroke. And I was working a lot on strength and also flexibility, keeping my fingers from becoming a claw, a lot of stretching exercises. My community OT has been a valuable resource for getting equipment that I will need, such as a hospital bed and a mechanical lift. And he's been super helpful. The things that I need to get in the hospital to help me get by, I will need at home as well. The OTs have become part of my social circle, part of my family. They've both gone beyond the call really to help me. The OTs have helped my family also learn the exercises that I will need and how to use the resources I have. When I had my stroke, it didn't affect just me, it affected my entire family really. And they had to learn as well how to help this post-stroke me get by. Brain recovery, the brain likes positive energy to recover. So I've had to remain positive. And the way I do that is take over really take ownership of the stroke, there's no point getting mad at it. I can't go back and change it. I just have to accept that I'm going to do things a new way and I have to adapt to that. And that's really helped me stay positive. And OT has helped me do those things.
Okay, so welcome back, and I hope you enjoyed that little segue into the patient perspective. And we'd like to talk a little bit about just the rehab portion of it. And with that, Allison, you've got some thoughts about rehab, and also maybe talk about rehab and talk about what got you into this profession and just what some of those little nuggets from the patients that you experience are.
Well, I started in occupational therapy over 22 years ago. I went to university for 4 years, and initially I was in nursing and then ended up transferring into occupational therapy because I love working with people, I love solving solutions, I love helping people to achieve their goals. I came to the rehab department last year and ended up coming onto the rehab floor, where it is the most amazing group of people. We work with individuals who have had injuries from car accidents, who have lost maybe the use of one side of their body from having a stroke, multiple different injuries and illnesses and conditions that maybe don't allow them to do their everyday occupations or activities that they would like to be doing. So a really important part of what I do is I work with a team of professionals, nurses, physiotherapists, doctors, social workers, and as part of a team, we help individuals get stronger, we help them learn how to do things in a different way, and we help them get strong enough to and confident enough to be able to go home.
Wonderful. Same question to you, Jonathan. So what got you into the whole profession, and do you have anything to talk about your areas of expertise?
So for myself, I graduated from school in 2022, so I've only been working for about a year and a half, so still fairly new. I kind of knew right from the start that I wanted to work into healthcare, and then luckily I had an opportunity to volunteer with occupational therapy during my bachelor's degree, and I really enjoyed it, and I kind of knew from there that's what I wanted to do. I'm so glad I did it. In my current role here, I'm working in more of a mental health role, so looking at patients, doing assessments, and again, kind of seeing where we can help them to optimize their function and what kind of supports they would benefit from in the community.
Mm-hmm.
Wonderful. So either of you, if any of our viewing audience wanted to access this center, or how would they go about doing it? Would they talk to their doctors or what?
Absolutely. They could talk to their family doctor. They could call home and community care services. They can also approach private clinics that offer occupational therapy.
Okay, wonderful. So any thoughts from you, Jonathan, on we'll go into final thoughts now. That anything that we might have missed on this session here?
I think we've done a good job covering occupational therapy. I think just being able to get the word out and so people kind of know what we do and how we can help them is the biggest thing. It's a great career, so if anyone's looking to go into it, would recommend it.
Absolutely.
Wonderful. And Allison, what about final thoughts from you? Is there anything that we still need to cover here, or any thoughts about the hospital foundation? Any thoughts about patient rehab? Anything like that? Final thoughts?
I think one of my final thoughts is I just want to share how much I love occupational therapy. It's an amazing profession, and the skills that OTs bring to the table are just as diverse as the people out there who could benefit from their services. We're talking physical health, mental health, helping people with their cognitive skills, and OTs in particular are a unique breed. We are, just always coming up with creative solutions and different ideas. It's always on a case-by-case basis, and we're problem solvers. So we want to work with our clients to help them achieve their goals.
Well, thank you, Allison. So again, I just want to say thanks to our viewing public out there. Thank you for joining us. I'd like to say thank you to our guests, Jonathan Leong, Allison Hallam. I'd also like to thank Melissa Bertoli from the Hospital Foundation. I'd like to thank Occupational Department Therapy here for being so personable and willing to, put this information out there. And also for the people that are working behind the scene. Jeff, Lydia, you know who you are. And my name is Rita Weeb, and thank you for joining us.